Well, Tess Ingram is a spokesperson for UNICEF, and she kindly joins me live on the line now from Amman in Jordan. Welcome, Tess. People are obviously aware of the dangers of the conflict in Gaza, dying in the fighting. People are starving to death. It's as simple as that. But there are so many other dangers for children in the region. Maybe people haven't considered. It's the coldest month of the year there. Children are suffering from trauma, from things that they see, the death and the destruction. There was a remarkable tweet your organisation put out, I think this was yesterday. 9,000 Palestinian children had a limb amputated during this conflict, 1,000 of them having that operation without anaesthesia. What are the biggest dangers you see to children now?
Well, it's just danger upon danger and horror upon horror for children in Gaza at the moment. As you say, we see injuries and deaths from the airstrikes and the hostilities continue to mount. It's actually 9,000 children who've been injured, and that's an undercount. We're almost certain that the numbers have increased since then. And then there's about 1,000 children that we know of who have had amputations. Now, we believe that some of those have had them without anaesthesia. Colleagues met a 17-year-old girl in Al Shifa Hospital in the north last week, and she just had her leg amputated without any anaesthesia. And they told me that she was still sitting on a stretcher in the hospital, smiling and being, grateful for the care that she was receiving. But it is so limited in the hospitals, as you were saying, where, in Al Shifa Hospital in the north, there were 1,000 patients there, as well as about 50,000 internally displaced people. So it's very hard for medical staff to continue to do their work in those sort of crowded situations where there's fewer and fewer doctors and fewer supplies.
Yeah, thank you for correcting me on those numbers. Obviously, though, the problem is still very evident there. And another thing that maybe people haven't considered, the danger posed by children not getting their vaccinations. Your organisation is one of the biggest suppliers of vaccinations to children worldwide. What challenges are you facing in getting the vaccinations through? How much danger does that pose to children there?
We're very worried about outbreaks of vaccine-preventable diseases, Neil, because there was obviously a disruption in children receiving their vaccines over the last few months as health services collapsed. So UNICEF has been doing our very best to bring in vaccines to try and bridge that gap and keep immunity levels high so that diseases don't break out. And we're talking about things like measles, which is a very contagious and deadly disease, particularly for small children. So we've got some measles vaccines in on Christmas Day, and some more of the kind of routine vaccines that children receive arrived yesterday. But as you say, it's very difficult for us to get aid in at the moment, and much more needs to happen to enable not only the arrival of aid into the Gaza Strip, but then the safe distribution of that aid across the Gaza Strip.
You talk about how hard it is to get aid in. There were reports yesterday that an aid convoy, a UN aid convoy, was actually fired upon by Israeli forces. I mean, as it was reported, nobody was injured, but it shows the risk of the work being done by other people taking the aid in. In terms of how much is getting in, I suppose what's needed, I mean, how would you assess it? What percentage of aid is getting in compared to what is required?
Well, as an example, 81 trucks got in yesterday, and before this escalation in hostilities, the UN used to get in about 500 trucks a day. So obviously the situation is now far worse, the needs are greater, and we're getting in only a very small percentage of the aid that we need. And this is because of long screening processes at the now 2 checkpoints that are operating, restrictions on what supplies can come in. And then, of course, once we're inside, the hostilities make it very difficult for us to get the aid to the really vulnerable children and families that need it. And so that's why we've been calling for this immediate and long-lasting humanitarian ceasefire, because it really is the only way that we can see that we can help the people of Gaza and for the fighting to end.
Appreciate your time. Great to speak to you. Tess Ingram is my guest, spokesperson for UNICEF.